Sickle cell anemia in a minute. So basically this is an autosomal recessive disorder in which your beta chain 6% glutamic acid is replaced by valine producing HBS. The problem with HBS is when on deoxygenation this HBS can produce polymers and pseudocrystalline structures producing abnormally sticky membranes RBCs, which can later progress to microvascular occlusion when they are passing through small capillaries, and it can, due to ineffective erythropoiesis, this can result in hemolysis. So what are the clinical features you get in sickle cell syndrome? Actually you can divide them into crises and other features. There are 4 named crises: acute painful crises due to microocclusion and marrow involvement, which can produce systemic features like fever, etc. And acute chest syndrome. In this there is in situ sickling plus fat embolism into the lungs. This can ultimately result in respiratory failure. And sequestration crisis, where there is thrombosis of the venous outflow, classically happens with the spleen and penis. This can produce splenic sequestration crisis, priapism, etc. And aplastic crisis, when there is a parvobenign infection, it can produce a self-limited red cell aplasia. Okay, so these are the 4 named crises. Then plus isosthenuria, this happens more with the sickle cell trait, and osteomyelitis and aseptic necrosis of the femur, osteomyelitis with salmonella, and stroke in young, it actually produces stroke in children. And priapism is painful erection, and involvement of eyes in the form of retinal hemorrhage, retinal neovascularization and retinal detachment, and involvement of extremities in the form of dactylitis and chronic ulcers. Okay, so how will you evaluate? If you do a CBC, HB will be low. If you do a liver function test, indirect bilirubin will be elevated, reflecting hemolytic anemia. If you do a peripheral smear, you can see sickle cells, target cells and reticulocytosis. And the diagnostic test is HB electrophoresis. You will be getting a predominant HBS. And treatment of crises, it is simple. You give vigorous rehydration, adequate analgesia. You can consider IV or oral morphine, adequate antibiotics, oxygen to control hypoxia, and transfusions, especially exchange transfusion if saturation is less than 90% in acute chest syndrome. And what is the role of hydroxyurea? Hydroxyurea can actually increase HbF levels, and this HbF will actually help you to prolong this sickling, and it can also reduce the pain of this painful crisis also. And the only curative therapy is bone marrow transplantation.